Hi, I'm Kaitlin King, and I'm an instructor at the University of Manitoba in the College of Rehab Sciences in the Department of Respiratory Therapy. I'm here today to talk to you a little bit about ventilators. A ventilator is a very complex machine that helps people breathe. To give some context of how much there is to learn about ventilators, respiratory therapy students at the University of Manitoba spend 3 years learning how to initiate, troubleshoot, and manage these machines. When a patient is on a ventilator, they are intubated. This means a breathing tube, which is this, is placed in either their mouth or their nose, or in their neck as a tracheostomy tube. This is how you would intubate a patient. We put something called the laryngoscope into their mouth. Our breathing tube is then passed and placed in the patient's airway. We hold onto the tube, pull out what we call the stylet, which basically holds the shape of the tube. We put on something called an End-Tidal Co2 Detector, which tells us if we're in the lungs. If it turns yellow, yellow means yes, so we're in. And then we also inflate the little balloon that is around the tube, which is called the cuff, so that nothing from in their mouth falls down into their lungs. The respiratory therapist enters data, known as ventilator settings, into the ventilator. The ventilator will then interpret that data and output breaths to the patient by the breath delivery unit through that circuit tubing and into the person's lungs. These breaths may be supported or completely controlled if the patient is not breathing at all. Therefore, depending on what mode or breathing program the respiratory therapist has chosen, there might be different settings that are available to them. These settings include things like how fast the breath goes in, how large of a breath we want to give the patient, how long of a breath we want to give the patient, how much oxygen, etc., and whether we're giving them these breaths with either volume or pressure. It's important to note, though, that every patient will have individual and unique ventilator settings that are tailored to their individual needs. There are many reasons somebody may need a ventilator. A breathing machine is something that is used in many different scenarios. But in the case of COVID-19, the body is not usually getting enough oxygen into the lungs. So respiratory therapists can act as the lungs while the patient is recovering. In some severe cases, sometimes patients may need the ventilator for weeks. And it's important to note that the ventilator does not cure the disease, but it does help us manage it.